learn more about how we can heal ourselves, help ourselves, and understand what it is that we can do to raise our IQ about being able to save our lives and live longer and more productive lives. It's really important for us at Health IQ that we give you access to professionals, individuals who are practitioners, individuals who have a true competency and understand the culture of Health IQ, the culture of being able to talk about those issues that our community faces and use a lens that is culturally appropriate. Tonight, I'd like to say thanks to AARP for sponsoring this segment, but if nothing else, I've got a super panel. Individuals who are dedicated to changing the disparities in our community. So, first up is Dr. Tamika Knox. She is a Spelman graduate, then an IU graduate, and then obviously part-time professor and medical school professor, that is. And she also practices medicine as well. So we'd like to thank Dr. Tamika Knox for coming tonight.
Thank you for having me today.
And of course, AARP, who has been more than just an advocate, but actually a resource and a tool for those who are looking to understand for free, if you choose to go and understand that AARP is there for you. And that's for the entire community, not based on gender, not based on race, but just to understand that there is a resource who wants to advocate for a better life for everyone. So please welcome Paula D. Cunningham.
Thank you.
Last but not least, my Morehouse brother, who clearly is Dr. Dave Montgomery. How are you guys?
All right. Doing great. Thank you.
You know, I remember when we first started Health IQ, everybody was talking about how, health disparities, and it wasn't really affecting Arizona, and it hadn't really gotten to Montana. And, I'm just like, we know about health disparities before COVID. Like, y'all are being very inappropriate. Health disparities didn't start at COVID for our community. Like, let's narrow that down. Like, it's a point, but it's not the point. At the end of the day, COVID goes away, our disparities are still here. And for me, that's just where I'd like to start our conversation so that we don't get tripped up in understanding what health disparities really are and how we can actually begin to change the focus, create advocacy for our community, and reduce the impact of health disparities that we even inflict on ourselves. Because I don't want to blame purely a system. Obviously, there's a system of racism. Obviously, there's a system of classism, all the isms. But I do want to say that we play a role in our health, and our Constitution must change and reset today. So I will start with Ms. Knox. Ms. Knox, how would you define health disparities for someone who really doesn't understand what it is and how it impacts their life and actually the amount of time they'll have on this planet?
I think the hardest thing to talk about when you talk about healthcare disparities, especially when I talk to my medical students about it is multifaceted. It's not just one thing, it's multiple things. Not only is, one of the things is healthcare access. Do patients have access to healthcare? How close is their local clinics that they can go to? Can they get there via the bus system? The other part is, do we utilize it? It's hard to not talk about the fact that healthcare disparities has a lot to do with utilization as well. Are we trusting of our doctors to give us the proper care? If I go see a physician, do I feel like they're listening to me? And if they are listening to me or feel like they're not listening to me, am I going to take that medicine and that advice? The other thing is, COVID definitely put a big red dot on healthcare disparities where everybody can see it. But our occupations put us at risk for healthcare disparities as well. So we have it's a multifaceted thing. Our housing, where we live, we tend to live in major cities, in apartments. So all of that together puts us at risk. And so it increases our likelihood of morbidity and mortality. So deaths, as well as bad outcomes, essentially.
Beautiful. We're going to go to you, Ms. Cunningham. Same question. Healthcare disparities. How do we define them? How do we perceive them? And allow us to focus right now on now.
Well, Dr. Tamika, Dr. Knox actually put the exclamation point behind it. It is multifaceted and it is historical. All COVID did was shine a light or illuminate what already existed. The disparities have been there ever since my niece died in a Chicago hospital because the white hospital wouldn't take her, and she had asthma and she had pneumonia and she had to go to a black hospital. In that transport, she died decades ago, but it existed then and it still exists today. Just look at the data, look at who COVID is impacting the most. People who are on the front lines, people who are low income, people in urban communities, older adults, those who don't have access to broadband and to telehealth, those who don't have access to transportation. A lot of it, yes, is systems and how the systems are structured and have been structured for years and years and years. But also a lot of it is the way that we perpetuate those systems and that we don't provide the kind of learning, education, and access that we know can make a difference. In Michigan alone, Kellogg did a study that showed we can save, the state of Michigan could save over $232 billion over 10 years if they bridge the gap in healthcare disparities. If they just bridge the gap. You would think every elected official out there would jump all over that. It's a huge savings for the state. And yet we're fighting tooth and nail, day in and day out, to get broadband, to get telehealth, to get lower prescription drug prices, to get transportation, housing, education. You want children to learn at home online? Only 50% of Detroit has access to online learning. And yet the Wayne County, where Detroit sits, has 97% access. So you want to talk about disparities, we could talk about it all day, but I want to talk about how do you bridge that gap? How do we fix this? Because now's the time.
That was well said. Thank you so much. I appreciate it. Same question, Dr. Montgomery.
Yeah, I think, what Dr. Knox said and Director Cunningham said is right on the money. Disparities, disparate, difference. It's a difference in three main categories. It's a difference in the quality of care that people get. It's a difference in the access to care, Dr. Knox. And it's a difference or disparity, a large disparity, in what we have deemed the social determinants of health, the things that are around you that are not you, that literally directly or indirectly impact your health. Now, I want to just add to this, a comma and say it has less to do with socioeconomic class in many regards, because quality can be very different no matter how much money you have or where you sit on that socioeconomic hierarchy. And one of the popular cases in point is Serena Williams. How many people know the case of Serena Williams where she's saying after pregnancy, there is something that is not right? No, you're fine. Let's go home. She was like, no, I am not going home. Something's not right. She had a massive, what Dr. Knox and I call PE, which is a large clot in her lungs that could have killed her. So it doesn't, that's just one example to shine a light on. It is less necessary, although it's important, less about socioeconomic class than the assessments and impressions that people make based on the color of your skin or the assessments that they make when they look at you. And whatever that is, right? We've been talking about unconscious bias for a very long time, but some of these celebrity cases have shown a light on this, and COVID-19 has brought this into crystal clear focus. What Director Cunningham was saying is that, guess what? While you think it doesn't involve you, while we had the luxury before COVID-19 to just sort of say, yeah, that's those people over there. They're not taking care of themselves, right? Oh, they eat fried chicken. Oh, all of these different things that come out of it. What COVID-19 shows is, in fact, what you ignored before is directly impacting you too, right? Actually, the disparities impacted you before because it's coming out of your tax dollars. Just one example. When you have to pay billions and billions of tax dollars to try to take care of somebody who could have gotten preventive care as opposed to rescue care. And so COVID-19 says, look, check it out. I've got another anecdote for you and I'm going to stop. the people who are on the front lines in terms of the healthcare administration in the United States are largely not in the class of people we're talking, the group of people that we're talking about, right? People who have the disparities that are really affecting them. And so what happens with something like COVID-19 that affects everybody, you have somebody who is poorly taken care of. They don't have access, they get poor quality, they get COVID-19 and they're an essential worker. So then they pass it to you because they go to the hospital very, very ill with this. And the you that's taking care of the person with with disparities is almost always not a Black person or a person of color, I should say. Okay. So what happened? Here's an anecdote. That person takes care of the Black person who's been shunned in healthcare for all intents and purposes, and then that person takes it to her mom, and her mom dies. I have an example of that happening. So if you can't see right now with COVID-19 how we're really all in this together, and that this disparities in healthcare is not just people whining and, oh my God, go run and stop eating potato chips, that this is more than that, that this is a structural problem, this is not just a personal problem, then we've got a long way to go.
You're a good storyteller, Dr. Montgomery, because we all need better stories. And if you're watching, I want you to be able to repeat some of these stories. Like, there's no need to get information that you don't take and own as your own, and you can just say, well, I was hanging out with Dr. Montgomery and he shared the impact. So for me, I want everybody to really increase your IQ by understanding these stories so that we can share them as a community and become part of our legacy of being able to share what you said. So I appreciate the story. The question for me is just advocacy. How can we become advocates to each of you as it relates to our health? Because we kind of let things happen. We're not sure what to marshal. When you said, Director Cunningham, when you said, well, they won't get telemedicine. And in Detroit, where we know there is Comcast, 50% of the people still don't have cable. How, we'll start with you so that we give you that opportunity, Director Cunningham. How do we begin to advocate for ourselves as a community as it relates to COVID, not COVID, just disparities?
Well, first of all, people don't even know where to go. I mean, just trying to even navigate their own personal health care. It needs to be an integrated system in terms of just a one-stop shop for people to be able to pick the phone up and ask for whatever they might need. We do have to take some responsibility. We can't point a finger at everyone else and say it's their fault because I didn't get a good education, or it's their fault because I didn't know this or I didn't know that. AARP does a phenomenal job of going into communities and sharing information, informing people, advocating on behalf of those who are 50 and older. But there does have to be some responsibility for folks to continue to ask questions of their doctor, to continue to follow up with those doctor's appointments, which has been an issue during this COVID-19, but during this pandemic. People don't want to go to the doctor. You know, we talk about advocacy as though it's someone else's responsibility. Well, if I'm not, just like with Serena Williams, if I'm not feeling well, I need to pick the phone up and say, call somebody, my pastor, my mother, my next door neighbor, my somebody, and say, y'all got to help me. This is continuing, something's wrong. Instead, you know, we kind of, and this is not, because I'm a church going woman. I was brought up in Sunday school, all right? But sometimes we just want to pray it through. Well, that's wonderful. You can pray it through. Absolutely. Keep praying, but also put some feet on those prayers. You know, get up and take some action. The prayers will come to fruition, but you got to do something sometimes. And so sometimes faith and medicine and healthcare, all that, it gets complicated in people's minds, but you've got to speak up, speak out, and advocate for yourself and call someone. And then there's just simply, again, that the whole question about access. I don't know who to call. I don't know where to go. I don't know what to do. Well, I'm just going to put a plug in here. Call your local AARP office. We'll help direct you somewhere. I'll get you some answers someplace. And we're free, you know, so you don't have to even be a member for us to direct you to get some of the support that you need. And I do think there needs to be more of an integrated healthcare system, though, that people need to be able to go and say, I don't have transportation. And not just sit home and don't go to the doctor because they don't have transportation, but know where they can go to get transportation. Whether it's a self-driving car that comes to pick you up in Detroit, you know, on that little trail and takes you to the doctor and brings you back, or whether it's calling the doctor's office and saying, I'm going to miss my appointment because I don't have transportation, and that nurse's assistant or physician's assistant knows where to call to get you some support. So it really does need to be an integrated system. of advocacy and also continuous learning and teaching to communities, neighborhoods, and everyone.
I'm down with the cause. I'm real concerned about us really understanding what advocacy is. I'm really concerned that we aren't sure about the numbers, but we'll get to that a little later. How do you see advocacy? Because you're all the way teaching medical students about how they can advocate for their parents. I mean, not parents, their patients. But how do you see advocacy? Because I think we all see it differently.
When I think of patient advocacy, I think my biggest thing is thinking of, I tell my patients all the time, come with a list. Because a lot of times what happen is I have an agenda when you come in for a follow-up visit. My agenda is to take care of your diabetes and hypertension. But that day, you may not want to do that. Maybe you've been depressed because you lost your son a couple of years ago, which was a patient this morning. So they had come in for one thing, which was their follow-up for their chronic conditions, but that was not what their number one problem was. And so when you come in with a list, then we can work together so that you can advocate for yourself and we can work as a team. Your doctor should not be dictating to you what your healthcare looks like. You and your doctor are a team together. And so if we don't have a team approach, you're not going to do what your doctor says. So the best thing you can do to advocate for yourself is to have a list. The other thing, which Director Cunningham said, is the other option for advocating for yourself is what are your options in your clinics? Our clinic specifically has Lyft. So if you cannot get to the doctor, we have social workers that will help you get there by Lyft. But if you don't ask, we're not going to realize that you're missing 3 appointments because you can't get to the doctor. We assume you're missing 3 appointments because either you forgot or it wasn't important enough for you. So ask, I can't get there because I have no way of getting there. And we will find a way. And so again, that comes from communication. So making sure you communicate with your physicians. And the other aspect of this advocacy is I am teaching physicians, future physicians, how to advocate for their patients. What do you need at your office? You need a social worker. You need that ability to come up with a team approach so your patients can get where they need to go, because everyone doesn't have access all the time. And so I think the biggest thing is making sure we're teaching our future leaders and our future physicians to do that, as well as teaching our patients how to advocate for themselves.
Thank you. Same question, Dr. Montgomery, because I know you got an innovative approach. So we're looking forward to that.
Yeah, I don't want to take up all the time. Here's what I'm just going to add, because I think what Dr. Knox and Director Cunningham have said, again, are really right on the money. But I wanted to make a distinction at this point, a distinction between insurance, right? Dr. Knox sees people, I see people in the office that come with insurance. And there was a big battle, and still is a big battle about insuring people. But what she also said was you may not utilize it if you don't have the insurance. So here comes a distinction. Insurance is not agency, because you can have very many people who work and have insurance, but don't feel like they have the agency to go into a doctor and tell them what's wrong, and the entitlement, a positive entitlement to come in and advocate for themselves. So the burden is not just personal. As a matter of fact, the barriers were not put up by the person. So the responsibility to fix the barriers cannot just be on the person. We should talk about the person sort of superseding and overcoming if one can. But until the people who are the purveyors of health teach what they know to those who do not know, then you're not going to get somebody who has agency to know that I don't have to make $150,000 to go and get preventive health care, right? The agency says I can tell my employer, who has the responsibility to let me off for a few hours to go to my doctor's visit, right? That I don't get fired. There are people who think they cannot ask for a few hours off, not a day, Mr. Steed. I'm talking about a few hours just to go get a checkup. Forget about preventive maintenance. Are you kidding? We're going to the ER because it's fallen out by that time. So the agency is something that we have to teach people how to do. And guess what we've done in healthcare? And I will tell you that the Academy has doesn't like me anymore because I say stuff like this. we don't do a good job at marketing. And that's why I'm, say, oh, well, Dr. Dave, you just want to be on TV, because I do media and all this stuff. And I tell them, as soon as the stuff that we're talking about today is no longer something that we talk about currently, and that it's history books, then I'll sit down off TV. I'll stop having people hear me say that you can actually have the best health of your life if you go to somebody who cares. You go to somebody who you trust and tell them what's happening. But guess what? Many people feel like they can't do it. And until we decide that it is just as important for us to teach people that they can go to, you don't have to attitude, you can be very, very nice, right? We know that the nicest people get the best care, no matter how much money you have in your pocket. But we teach them what to ask, what to look out for. We're the only ones that know that. We went to school, paid all that money for it. They don't know that. And until we decide that that's important, it doesn't matter about insurance. You can have all the insurance in the world, but people won't utilize it because they feel like they're not entitled. They don't have the agency. So a really important distinction.
Thank you. I'm gonna steal that, and I'm not gonna have anybody imagine that they got agency over me. I'm gonna let them know. Dr. Montgomery said, and he knows that I got the power over this. Did I get it right, Doc?
That's that in a nutshell. You got it. You hit it out the park.
No, I think the other thing is just the bias, how to identify it, because there are, when we see the role that these biases, preconceived biases, but I just think they freaking biases based on racism and systematic oppression. But when we think of this, what should we be doing when we're experiencing it? Because I've had way too many people have the experience. There's actually in Detroit, we've got a story about an angel of death. He went twice, sent home, said he didn't have COVID. And he went past outside of Detroit just to get to a doctor because he couldn't breathe. And finally, he said, I don't care what it costs. I'm not going back to that same hospital system in the city. How do we get past this? I'll start with you, Dr. Knox.
Fortunately, this is where, I totally agree with Dr. Montgomery. It's a hard thing for you as a patient to get past social biases, because you can't get past, if a physician has a social bias against you, it's been literally proven that medical students and residents think that African Americans have thicker skin than most other races. It's been proven that, seriously, like that we have a higher pain tolerance, so they are less likely to even give us pain medicine. So it's a really difficult thing to get past someone else's bias. And, as Dr. Montgomery said, how does a patient do that? Well, the only way you can do that is to demand that you are heard. And the other part of that is that me as a teacher and a professor teaching my medical student that we all have some inherent biases in us, and to teach ourselves what we need to do about those inherent biases, to put it behind us so we can take care of every patient, not just a patient that looks similar to you or that you're comfortable with. Because a patient, it makes it really difficult. Unfortunately, luckily, that patient kept going to different hospitals until he found someone who would take care of him. And that may be what patients have to do until someone can listen to them. But is that fair to them? Absolutely not. Because if you can't breathe, someone should take care of that. And so it's a really hard thing for patients to have to overcome, is their physician's biases.
I almost felt like it wasn't just the physician. I'm not even sure he made it past first base. I mean, and with insurance, which was the most frightening thing, this is a person with insurance that literally was turned away or not sick enough. I guess that would be the other thing, that they're like, oh, or Robitussin, as they said, and sent him home. What would you say about these biases, Director Cunningham?
They have been with us for a very, very long time. They've been with us always. We weren't born with them because if you're a baby, and whether I'm black, blue, brown, or white, I can hold you and you won't cry. We can go to watch children on the playground, who haven't been taught those biases yet, and yet they still exist. And so they are taught. They are absolutely taught. They are learned from social norms, from society. You look at what happened with COVID, even in Detroit, when an Asian man was grocery cart right after COVID was announced, everything was going to be shut down. There was going to be a stay at home, and they spit on him and threw over his grocery cart because he was Asian. This is now the Asian flu. Where did that come from? Where did that come from? Just because they saw an Asian man and they thought this was an Asian flu, and then all of a sudden now they're going to demonstrate that kind of hate, whether it's healthcare, whether it's school, wherever it is, those biases are there. And you're asking, how do we get rid of them in healthcare? How do we get beyond those so that we can get treated? And that's a $64 million question, brother. I mean, if I had the answer to that one, I'd be out on the pulpit somewhere, probably telling everybody how to do this. We have to, again, it sounds trite and it sounds Pollyanna, but we've got to expose people to different cultures. We've got to have dinner with people who don't look like us. We've got to talk to people who are different than we are. And, Dr. Knox said it well. We've got to teach people in medical school and caseworkers, social workers, everyone else, how to manage these biases that you have. Whether you're obese, whether you're skinny, whether you're tall, whether you're short, we have them. And so when I walk into an office and because my color, my pigment is different than anyone else's, I don't want to be treated differently for my health care than anybody else. So I need to watch you, you need to watch me, and we need to talk to make certain that, no, it's not because, I'm eating fried chicken on Sundays. It's not because, I could be vegan, but there's some preconceived ideas that some folks have about you based on the hue of your skin. There's some preconceived notions that people have about you based on the way that your eyes might be slanted. How do we get rid of all that? I think you have to learn to manage it until we do get rid of all of it. You've got to learn to manage it both from an advocacy standpoint and also from a professional standpoint. But if I had the answer to how we get rid of all these preconceived biases, I'd have the CEO t-shirt on, be all over the country talking about how to do that.
Dr. Montgomery.
Yeah, I think, what they said is right. There's not going to be a magic bullet to the bias part. The purists in science will say that, an animal developing a bias, is a survival mechanism. But humans have taken it to a totally different level of hatred and vitriol and venom that, it's unconscionable. Some of the stories that, Dr. Knox and I are, privy to every day. The bias that sticks out the most is a bias about your willingness to take care of yourself. And that there are very many decisions that are made, even in my own field of cardiology, where decisions about what kind of level of care to give, the quality, right? Same two different people, same problem. I make a different decision about the way I'm going to take care of one person than the other based on what I have presumed you will do with what I give you, right? And we're not talking about limited resources. We're just talking about this is an insured person. We're in the same hospital. I think that you will not go home and take care of yourself. So I'm not going to prescribe the top line therapy that will get your blood pressure under control and keep you out of my ER. That's the problem that we're seeing that is both, conscious and unconscious. Some people are doing it because they had a really bad experience with a Black male who in their training, something terrible happened to them, and every Black male kind of has to deal with that. There's the unconscious bias that gets perpetrated, in our entertainment venues and things like that, where people will take, something an entertainer did and then overlay that on a complete professional, like nothing to do with any of that stuff. And as ridiculous as it sounds, it actually is happening as we speak right now in ERs, top ERs. I'm talking about great hospitals all across this country. It's happening right now, without any kind of remorse or anything like that. There's no difference. And the race of the provider matters. The race of the provider matters in that bias, because I will tell you, a quick story, and then I'm gonna stop because I'll keep going. I'll tell you a story. 30-year-old mid-level executive calls me for a second opinion. She's 6'1", beautiful Black woman. And she comes in and she says that I was hospitalized about 3 weeks ago. And 3 weeks ago, I was in what we call heart failure. So her heart was big and dilated. All her chambers had gotten big because there was an insult to the plumbing in her cardiovascular system. Well, she was in congestive heart failure. She couldn't breathe. She got swelling in her legs. And this was got it together, making somebody millions of dollars, well-educated, well-spoken, well-dressed, like all of the wells you can think of with hyphens next to them. That's what she had. And she comes to tell me that the doctor said that we're just going to put you on these medicines and see how this goes for the rest of the year. Now, Dr. Knox and I are, Dr. Knox has listened to the story like, what are you talking about? Have you figured out if there is a surgical correction? Have you been to the advanced heart failure team? Have you gotten, evaluations by all of the different specialists? And just the idea that you can take this young woman who could have, even if she got a transplant, she could have a fruitful life for 4 more decades. That you didn't do it instantly when she was in the hospital, but that she had to come to me almost a month later to try to say, something's not right. I'm just on these medicines. Is there anything left? Now, come on, really? That's what I'm talking about. There's this woman is 6 figures. She is a hashtag boss and got treated like she, hurt somebody intentionally. And that's what we're talking about these biases. They are occurring right now. That case was last week, two weeks ago. So yeah, we can jump up and down and you say, oh, well, what is the answer? Well, the answer is to first simply practice the guidelines on every individual in front of you. Practice guideline-based medicine to every individual that comes in front of you, and then you got it. You may not like them, but you're going to practice guideline medicine, right? I take care of some people who have probably used all kinds of words about folks that look like me, but I take care of them according to the guidelines, right? I take care of a Black person who use all kinds of words that you can imagine, but I take care of them according to the guidelines. And if everybody will simply just say, hey, first do no harm, and that means going to guidelines and taking care of folks, we could at least start there. You may not undo all your biases from your grandfather, but at least you can take care of us the same. And I think that's low-hanging fruit, quite frankly.
Technology, will it assist us in eliminating some of these disparities? Dr. Knox?
I think technology will help us. Director Cunningham had said earlier, essentially, we can't even do telehealth. We have patients in the inner city who have no internet. They have no ability. They don't have iPads. They don't have these things that, they are able to do. One of my patients just got released from the hospital. He has no way to get to me. Had COVID, lost a leg. He can't even get he cannot get a wheelchair to fit him. So he has no way to get to me and has no ability to do even a telehealth visit with me. And that is a problem because because he can't get to me, I can still take care of him. So one of the things we've been doing phone visits. So there are some offices that do phone visits, but having internet, having access, being able to have the ability to have a computer, have an iPad would absolutely help some of these patients. And if we don't have that, if we don't have that technology, we're going to be behind. And that's just going to make that healthcare disparities even greater.
Director Cunningham? You're on mute. Gotta unmute.
Sorry. I'm glad you didn't hear my first 4-letter words that I said, but technology is a real thorn in my side because when you look at what's happening now, particularly with COVID, I had my first telehealth visit during COVID. Before that, was going to the doctor. What about the hundreds of thousands of people who didn't have a smartphone, who didn't know how to use a smartphone, who didn't have broadband access? What about the hundreds of thousands of folks, 60,000 children in Detroit who didn't have access to even go online to finish their education? So technology is a major part of of our healthcare, and it's going to grow. It's only going to grow. I mean, I can right now, download, visit with a doctor anywhere, a specialist anywhere, and have that visit. Everyone doesn't have that access. That divide, that digital divide, will continue to grow unless we get people access to technology, to broadband, and not only that, because there's two issues here. One is access. The other is connectivity. So you get them access, but they have to learn how to use it. And there are a lot of older adults who don't. There are some who are 95 years old, and they're FaceTiming their grandchildren every single day, and they're playing bingo or playing whatever they play. But then there are those who don't even know how to use them, how to turn it on, and those are the ones who need it. When the chronic conditions going on, they can't go to their medical provider. They can't get there, as Dr. Knox was just saying, whether it's COVID, whether it's fear, whatever it is. But at least if they could talk with them. And you think that's going to change after a vaccine becomes available? It's not. That technology, insurance companies are now paying for some of that technology when prior to COVID, they wouldn't pay for it. And so now that they found out it works, it's only going to get more and more prevalent. And so that divide will continue to grow, particularly for older adults. And it's one of the reasons why we are absolutely urging elected officials to make broadband part of their major budget for the country, for the communities, get the broadband, and then have a public-private partnership in terms of who pays for it. It doesn't have to be all one or the other. But let's figure out how to do this so that everyone can have access to the technology. There is a direct link between technology and healthcare. There's a direct link. If I have a chronic disease and I can't get out, I got a debilitating issue and I can't get out, I don't have transportation. If I can just talk with my doctor, not on the phone, but even just with a smartphone, they can see my eyes, maybe take my pulse, maybe I can stand on a scale and tell you what my weight is, or maybe have a blood pressure machine and take my blood pressure. That helps. And that's going to get a lot worse if we don't provide the kind of technology that folks need. And we need to do it today and not wait for another pandemic before we realize that this is a life-saving tool for a lot of adults and a lot of younger children as well.
All right, Doc. Dr. Montgomery.
Yeah, I mean, that's it. I mean, one word, broadband. Director Cunningham, Dr. Knox, absolutely, broadband. And broadband for all the reasons that were said, but also because this education piece that is so, it's hackneyed, right? We talk, education, but education can come in many forms. Education can come in formal education, people coming out doing webinars, seminars, and all those things. But you can't click on a webinar if you don't have really good broadband. If you have no broadband in your area whatsoever, and the people who don't have broadband in their area don't have mobile devices that they can just use up the memory on, right? I mean, if you're paying, month to month on a, to buy up some usage on a phone, you're not going to use it to go and understand the health news. Right. So broadband allows news to just cycle through. How many of us today alone, of the four of us sitting here and the many people listening, how many of us just flipped through something that was news today? I happen to know this panel did because we were talking a little bit about it before we came on. But what about health news? Now, there's a whole lot of health news right now with COVID-19. What about non-COVID-19 health news? Anybody flip through something like that? Well, many people have. But guess what? If you don't have broadband, you're not flipping through anything. You can't get even that information. And think about people who live in communities where the main language that is spoken is non-English. And you don't give them access to broadband that funnels through a language sensitive information. Well, guess what? You can say it all you want to, but it's not coming through because that language is not their first language. They don't understand that. And all of that is important because guess what? If the Hispanic or Latino person gets COVID-19, I can't send my kids to school. You can't send your kids to school. You can't go to, Bora Bora. You got to stay. You can't go anywhere. Actually, you live in the United States, so you can't even go to Europe. You got to stay. I don't know if y'all pay attention to that. You can't go to Europe anyway, right? If you want outside to open up, you make sure that the Hispanic person, the Latin person, understands what you're talking about COVID-19. Makes sense because we're all in it together. Broadband is the answer, right? You give everybody broadband that has some of those other filters and the stuff. I'm saying filters is probably the wrong word, but somebody in technology knows how to get that information to people who speak different languages, right? And it's not just Spanish, it's Asian languages, many of them, right? And getting that information out enough is somebody has it and it's a piece of cake somewhere. We're just not pushing it out.
That was cool. I'm not certain about, I just think when I hear you all discuss the issue, I'm in the media business, and I'm really afraid that the counsel that you give, Dr. Knox and Director Cunningham and Dr. Montgomery, is not top of mind, and we have not reset. Like I love all my individuals, and they're doing the kneeling, but I'm like, you're not saying what you're saying about broadband for our community. I'm not sure we have real health, and you can help me with this, all of you, but Dr. Montgomery and Dr. Knox, because you can prescribe it. We need health KPIs. Like there has to be a health conversation that every Black person, because just hearing you say it, I can now say my priority is, every household should have broadband, period. So clearly that's my message. I can imagine if Beyonce said, every household has to have it. I can imagine Dave Chappelle, along with you, Dr. Montgomery, and definitely bringing Dr. Knox, and then Director Cunningham helping me moderate, and then allowing them to do a whole kind of skit on this disparity, but creating KPIs that everybody can understand. Look, you got to take 10,000 steps or you're really going to have to go see them.
Yeah.
You got, and 10,000 on your phone, so you don't have to go buy anything to get it. You can just monitor yourself on your phone, and it's there. And for everybody, we want every baby to have broadband. Every single house has to have broadband. I'm really afraid that we're getting ready to come out of COVID without having any key performance indicators as it relates to health. I do not see it. I don't see it's not on the board. I love it. Our sister Kamala Harris is going to be the vice president, but I am afraid, and I talked to Dr. Ian Smith, who we all know, that we really are not reset, taking from professionals that I see here and creating just a clear list on everything that we want. Like I'm really concerned. How can we develop healthcare KPIs as a community so it's part of our the lexicon of our community? Because I feel like we just don't have it. Dr. Knox?
I think you start from the beginning. You start going and doing more community talks. You start by coming and talking to Munson Steve, CEO, about about this. You go out there and you educate. You educate our people. You talk to them. You ask them what they need. My mother is a social worker in Indianapolis Public Schools, and she's been there for years, and she is fighting for her students to get broadband and making sure that they have access. My sister is at a charter school in the inner city in Indianapolis, and making sure all of her students have some form of an iPad or a way for them to get their lessons. Why? Because this is important. If we continuously ignore that this is going to be a problem, we are going to be left behind, and that is a concern. We cannot allow our students and our health to be second rate just because we don't have access. And that is, you've got to keep talking. You got to keep teaching. I teach my medical students every day. I will honestly say that all the things that have been going on with social biases and racial injustice in this country has really activated my medical students in a way that I never have seen before. And I've been educating medical students for 15 years. And so I'm going to, by far, try to make sure that they are well educated in the fact that there is social biases. We all have them, and how are you going to overcome them to make sure you take care of your patients, and to continuously educate them in every year of medical school. And so I think as physicians and as directors and as CEOs, we all have an obligation to continue to work with our community to make it better.
I love you, and you make me so proud, because being dedicated to educating anybody is a whole trick bag. That is just being an educator. I mean, I want to take my hat off to you, because just educating at all. But your brother, I told you, I had 6 years of Morehouse. I didn't get the 4 like Dr. Montgomery was there. I want the person who can't fit in the wheelchair to not be fat shamed, but to definitely understand there is a protocol. If you'll walk with me every day, that we can walk down your way with you. And if it takes 2 years or 5 years, that if we move each and every day and if we start with 1,000 and then go to 100, or listen to because I do a podcast, Come Walk With Me, and you can listen to, I do them all in 10 minutes. So if you want to repeat the 10 minutes, you want to go to the other 10 minutes, that's cool. But I need my community to have a number, because I'm good on every preacher, and I tease my pastor, Charles Jenkins, all the time about coming up with KPIs. If we don't start using numbers, our community is not going to heal. If they don't know what a good glucose number is, like they don't know what a good bottom number and a good top number is, and your partner can't ask you, what's your bottom number? Then I am afraid that we will come out of this and you will have to keep training doctors that will still not give people, here's your top 20 things you have to know. So, you're a dedicated teacher. I know you're going to get them for me. But I really want us to have some reset numbers. I'm a little bit worried right now. I've been doing this for like 10 weeks now, thanks to AARP. But I'm afraid that the numbers are not what's coming out of the, and I'm asking. So literally, Dr. Knox, that wasn't a setup. Your brother needs your help. Because I'll say it. If you write it, I'll say it. If you write it, I'll print it. But really, it's the numbers. Director Cunningham, some numbers.
I agree with you. I absolutely agree with you. We have just since March in our town halls alone, because everything's virtual now, we've reached over 68,000 people just in town halls, not with Zoom or Microsoft Teams, just with town halls. And I think on every single one of those, there's been something about fitness, something about taking care of yourself, something about social isolation, something about your numbers. Although we work at AARP, we work primarily with those who are 50 and older. I think actually the answer to your question really rests with those who are in kindergarten through 20, K through 20, teaching them about movement, teaching them about chronic diseases, teaching them about blood pressure. It's interesting to me, I read a statistic, and it may not be exactly right, but in Switzerland, they don't have the same level of high blood pressure, because in restaurants, in their hotel rooms, just like they do here, they have coffee in hotel rooms, they have cod liver oil. And cod liver oil helps with blood pressure. So their incidence of high blood pressure in Switzerland is less than 2%. So what if we were to teach young people, like as part of your lunch every day, part of what you do as you grow up is to take cod liver oil. And that will prevent you from having all kind of other associated diseases. I think that's where it really needs to start. And I say that because you know how we are, and maybe I won't say you, but you know how older folks are. Once they get,
I'm happy to be in most groups. Can't you tell? I say I stayed in college 6 years. I was in a whole bunch of demographics.
Well, I'm with you. All right. So
with every group, every group.
I'm with you on that. So you know how folks are. I mean, they're set in their ways, and I'm with you. I'm with you. I absolutely applaud Dr. Knox for continuing that education. We do it in AARP. We do it in communities. We have small groups. We do it in churches. We do it in community. We do it in the library. We have our own team. We have someone come in and say, what's your high number? What's your low number? What's your filtration number? What's this number? So those numbers. But if I'm already, 60, 70, 80, and I haven't been walking more than a mile, it's not too late. It's never too late. You could be 95 and it's not too late, but you've got to have a certain desire. And I don't think it's all that person in the wheelchair who won't get up. I don't think it's all just because they don't have a desire to get up. There's some other things going on there. And those other things that are going on have been going on for a very, very, very long time. And so until you start breaking down some of those walls and some of those barriers, they may never get out of that wheelchair. But they need to understand what it means, what the consequences are if they stay there in that wheelchair. And they're making that choice. I used to tell my children, okay, you can make a choice. You can make a good choice or a bad choice, and here are the consequences. Same thing if you're 16, same thing if you're 60 or 70. You've got choices. and there are consequences to every choice that you make.
Dr. Montgomery.
Yeah. I'm gonna do a little call and response. Would you guys play around, play along with me?
Absolutely.
Let's do a little call and response. Okay. Health is your
Well,
yeah. Everybody knows that, right?
Yeah.
Health is your wealth. Let me. So Mr. Steed, you just hit this right on the nose. That if we truly thought that were the case, that health is your wealth, that you cannot enjoy the wealth that you have garnered if you are unhealthy. That stories like Andre Harrell just pull so hard at us that John Singleton should not be dead. When we see those messages, we don't know all about the cases of Andre Harrell. We hear a little bit about what happened to John Singleton. But guess what? If we really thought health was your wealth, I wouldn't only get 2.5 minutes on CNN or HLN when it comes to health outside of COVID. That the news media would actually give more time to real health. Now, because here's the prevailing wisdom. The prevailing wisdom, Mr. Steve, is that health is boring and nobody wants to hear it. And I just don't think that's true. I think if you present it in the right way, it's going to be received. Here's the other call and response. Stop, drop, and roll.
Roll.
No, it was like,
Stop, drop, and roll.
I thought we were going to do a dance. No, so we'll do it again. Just so you thought I was doing a little, like I thought it was a dance.
Slide or something like that. No, stop, drop, and roll. Here's my point. I'm hitting on what you said. KPI doesn't have to just be a number. Stop, drop, and roll. Everybody in our age range and some a little bit younger than us know stop, drop, and roll. And you know it because somebody drilled that into your head. Guess what? There is a stop, drop, and roll for every essential thing that we want to get across to people. And guess who the best people are to do it? Celebrities. And guess who with the best platform to do it? Mr. Steed is in the platform.
right.
It's right.
Yeah,
That's right.
You see what I'm saying?
I see how this went. Spellhouse. I see that.
Set it up nicely, brother.
Bam, they came back. I'm not sure. I think that we're happy to share it, happy to create the challenge. I'm kind of sad that there isn't a challenge for health right now going on in our community. Obviously, there's some guys I have in Detroit, actually, push-up challenge and a steps challenge every day. So we have to do X miles. But I'm not certain that we have the lexicon for better health coming out of COVID. I am real concerned that, if you don't write the lyrics, Dr. Montgomery, people will definitely not repeat them, especially when you have the WAP going on. So the WAP doesn't necessarily make me believe that we're on some health kick. I mean, I am a brother. I love my sisters, but I think the preoccupation by the machine right now has my community preoccupied on things that will continue to destroy our health. I do not see any influencer alive right now who is advocating for Black health as a primary. I think social justice is not seen as health. And I think everybody has said social justice is health.
Yeah.
Like every child should have broadband or there's no social justice. And obviously I cringe at the idea of going back to school for the children and even the workers, since 53% of all Black and brown workers can't work from home because they don't have that type of job. So we got 6 minutes. I'm giving you guys all my time. What can we do better to change diversity as individuals in the lives of others? We'll start with you, Dr. Knox, and go to Director Cunningham, and then end with my brother. Everybody gets a minute and a half.
All right. I think we have to start educating, and that's what, you already heard me say this multiple times today. I'm an educator. That's what I want to do. That's what, God has led me to do. And so, me and 3 other Black female physicians, we started the CAPE MD. CAPE is spelled with a 4 instead of an A. And all we are out here doing is trying to educate you about diversity, educate you about what you need to know to advocate for yourself so that you can go out there. It's absolutely true. You know, medicine isn't that interesting. People aren't that interested in it, but we can try to make it interesting. I could try to make it plain, because what do you hear? You know, what do our African American friends and family hear when they hear comorbidities increase your risk of death? They don't know what comorbidities are, or if they have those comorbidities. My job as an educator is to teach you what those are, so that when you see someone coming at you, you put your mask on, because you have those comorbidities. That's my job. That is what I'm out here to do. That's what me and my girls are trying to do. We just want to educate you. And I think that if we can continue to educate people, you know, that is where our wealth will come from. Because when you know better, you'll do better. You know, and that's, you know, that's the big thing. You know, we've got to continue to help our community understand what's going to make us better.
Super. Director Cunningham.
You know, I firmly believe, also an educator, grew up in education, president of a 30,000 student college, an educator at heart. I believe I have never met a child, a person, anyone on this face of this earth that didn't have value. And once people understand the worth, the value, that they have something to contribute, they are a gift individually. They are a gift to this earth, and they need to take care of themselves and need to actually fulfill their gifts, fulfill that which they have inside of them. And whether that means caregiving, childcare, talking to someone else, you know, checking on a neighbor, you've got something that you can contribute, but you can't do that if you're not in your best, if you're not using your best self, if you're not in your best mind, your best health, if you're not advocating for that. We're advocating for those who are 50 and older, but it really does start a lot younger. We've got to teach people that when I take care of myself, I'm taking care of my wealth, I'm taking care of my community, I'm taking care of a lot more than just my family, a lot more than just me. And so getting out, getting involved, getting connected, having people understand that you still have something you can volunteer, you can contribute, you can do something with your life. And that something doesn't mean that you have to be committed to a chair, even if you think that you've been in that chair, that to use Dr. Montgomery's analogy, that in that wheelchair for a very, very long time, or to use your, I think it was you, Mr. Speed, who said, person in the wheelchair needs to get up out of that chair. There's something there's some value there. That chair is not their life. And so we need to inspire, continue to educate, continue to teach, continue to reach out. And more than anything else, what we can do is never give up. No matter what the situation looks like, there's always hope. You know, you can live a couple of days without water, perhaps, or food, but you can't live very long without hope. And so we have to continue to inspire, in spite of what it looks like, in spite of what the terrain is in front of us, what the journey looks like. Never, ever give up. And if you want some inspiration, just look at our forefathers. You think this is bad. What if I had to send my son off to a war and not know when he was going to come back? What if I had to go and run through the southern wilderness to try to get to freedom? So we can get through this. Never give up, but take care of yourself, because you've got value. You've got a gift that's inside of you, and we want you to pull it out and to help somebody else, because there's no greater reward than giving back to someone else.
Dr. Montgomery.
Yeah, you know, I'm going to be brief with this. I think that one of the best ways to really push this forward is the media. And it is mass media as much as it is social media. There is no single place on the planet right now that can reach as many people instantly as media. And so when we think about media and we think about health, I actually, you know, and so Dr. Knox, I'm just going to kind of, you know, I'm just going to just ask you this. When you go to parties, nobody really cares if you're family, internal medicine, OB-GYN, they're going to ask you about their knee, their ear, their infection, right? You know why? Because, and they just met you. They didn't know you. They just met you. You look trustworthy. I want to ask you some questions. Will you please talk to me? Well, I'm trying to have a good time at the Christmas party. No, let me answer these questions. Why? Because everybody is interested in their bodies. Did you know that? Yeah. So this idea that people don't want to watch TV, you know who is the only game in town on television right now? What's his name? Anybody know? Yeah, the people who are watching us know his name's Dr. Oz. I love Dr. Oz. Guess what? He's still 10, 11 years later, the only game in town. He has shown you that health and taking care and thinking about your body is in fact fun. But guess what? We don't have somebody that looks like me on television. And guess what, Mr. Steed? Before I go out of this planet, long time from now, but before I go out of this planet, it's going to change, because we've got so much to get out, not just for people who are of color, but for everybody with a different voice, with a different message. It's fresh, it's new, and it's going to get a bunch of KPIs when you're not even thinking about KPIs. so that people can go live a healthy, fuller life. And that wealth that you're talking about, you get more wealth if you can think straight and you don't have diabetes. You get more wealth if your blood pressure is lower, you don't have a headache and you can't sit still, right? You get more wealth when you don't spend your time in somebody's ER because you haven't had a chance to get preventive care. And the way that we do that is to get that message out through the media,
We'll sign you up tomorrow. And the Four Capes are not trying to do a good job. You guys are doing a phenomenal job. You just made me think about my love, Dr. Legree, just so that you know. I knew who you were, so don't, Dr. Knox. But at any rate, I want to thank you all for coming on Health IQ, but somebody said Taru. Health IQ or Health IQ?
That's my guy.
Oh, it was Taru. I thought it was Health IQ. Thanks for you guys watching Health IQ with Dr. Tamika Knox, Dr. Montgomery, and of course, without AARP, who advocates for all of us, we couldn't have done as great a job. And we want to thank Director Paula Cunningham. I do want to say that it really wasn't for people in wheelchairs. I don't care where you are. I want you to move. I do want you to move. Whether you have to have somebody help you, let's get moving, folks. If you spend at least 5-10 minutes and let it add up to 30 minutes a day, we all can heal ourselves and at least take steps toward moving to be a better and healthier community. I'm Munson Steve. This is Dr. Tamika Knox and Director Cunningham and Dr. Montgomery saying all of you increase your health IQ and increase your life expectancy. We'll see you next week on Health IQ. Love you guys. Peace.
Take care. Thank you.